Live streaming 24/7. This is WRTV News, streaming now.
I'm Mark Mullins, bringing you the latest WRTV headlines. A bill limiting vaccine requirements in the workplace is one step closer to becoming a law in Indiana. On Tuesday, the House approved House Bill 1001. It would force private businesses to accept vaccine requirement exemption requests from employees. This is part of the debate that led up to the vote.
We are supposed to focus all of our attention on a small group of people whose anger is allowed to trump the concerns of the rest of us. You think the rest of us like getting all these shots, wearing all these masks, going through all these school closings? And we can't find a single thing that this body can do to improve our health and reduce this risk. Instead, we go after our employers.
When you said it's anti-civic duty, we're being driven by anger, I got to be honest with you. I've had very few people who've called and they're angry. I get calls and they're crying. I don't know what the future holds. Help me. Because I really want to not get this vaccination. My employers tell me I have to. I need some protections.
The vaccine exemption bill now goes to the Senate. The Indiana law would not apply to healthcare workers. Last week, the Supreme Court upheld the federal vaccine requirement for most healthcare workers. Indy Pride is resuming in-person activities after 2 years of virtual events and celebrations because of the pandemic. Indy Pride considered holding an in-person parade last year when several other events in the city returned. But the group's executive director says many people who attend the event are considered high risk for COVID-19.
We're not quite sure yet what the safety protocols will be during the events because we want to wait till we're a little bit closer to make those decisions. But we do have a brand new health advisory council that has been put together, and we are going to be relying on those people who are pillars in the community to help us guide through this.
The in-person Indy Pride Parade and Festival will be held Saturday, June 11th. You can learn more at WRTV.com.
COVID continues to take a toll on Hoosier schools. Data from the State Department of Health shows the number of positive cases in students more than doubled from last week. 15,485 cases were added to the state's dashboard, some of those dating back to July. The latest update also includes more than 2,500 cases among teachers and staff. The vice president of the Indianapolis Education Association says the rapid spread of Omicron has created tough staffing situations for local schools. WRTV's Rachel Wilkerson is taking a closer look at how the current surge is impacting students and families.
We are still going on that upward trend. We've flattened the curve the wrong way with Omicron, and especially in schools.
As COVID-19 runs rampant across central Indiana, schools are struggling. More than 15,000 new cases in students were reported this week. That's a new record.
We're seeing high numbers in elementary schools and high schools, middle schools. Omicron's just gotten to be a lot more contagious than previous variants.
Assistant Administrator of Infectious Disease Madison Weintraut says due to transmission, more schools have been forced to switch to remote learning. While the goal is to keep students and staff safe, she says it does have an impact on those who rely on school for meals.
With remote learning, we're looking at students outside of the classrooms where they're not getting the same structured learning environment that they might within the classroom. They're not getting access to the free lunches, to the social activities. The decision to move towards remote learning doesn't get made lightly.
Pike Township mom of two, Jennifer Rubenstein, says she understands the virus is causing headaches among schools, but says staffing problems are causing her children's grades to suffer.
If we need to go virtual, if we need to go remote, let's do it for a period of time. Let's have that plan so that parents can plan around that. And let's give our children a little sense of relief.
Pike Township tells WRTV that 9 of its buses had significant delays this morning due to a lack of bus drivers. We're talking 1 to 2 hours. Working for you, Rachel Wilkerson, WRTV.
Depauw University is requiring everyone on campus wear a KN95, KN94, or surgical mask while inside of any public indoor location. Our Megan Shin spoke with the school's pandemic response leader, who says the move was necessary to keep the campus community as safe as possible.
Stevie Baker-Watson, thank you for joining us here on WRTV from Depauw University. Tell us about this new mask policy that started on Monday.
As we're doing our reading and we're looking at what is happening with the virus, we think that it's it's more transmissible because the particle is smaller, and that a cloth mask simply isn't tight enough in terms of its weave to be able to have that protective effect. So we're asking folks to use something that's an equivalent of the KN95, the KF94, something that's equivalent, or even double masking if you need to, using both a surgical mask and a cloth mask in order to help ensure that particles aren't getting in and that you are not pushing particles.
Okay, so double masking, as you said, is an option if students for some reason can't afford a KN95 or KN94.
Well, that's key for us, why we put in there an equivalent for people. Really what we want to do is teach everyone on our campus to engage in more protective behaviors. We're looking for something that's got somewhere between a 3-ply and a 5-ply mask. And frankly, we don't necessarily see that right now if we simply use the term cloth mask.
So how many students have you heard from that are having trouble really meeting this requirement?
Truthfully, I've only heard from one.
Is the school helping provide these KN95, KN94 masks, and how much do they cost?
There were masks, both surgical and KN95s, that were delivered to, I think it was about a dozen of our offices across campus to be able to have on hand if people did not have them available to them. We're continuing to order some more masks. In terms of the price point, we think that it's worth it to spend that extra dollar, that extra dime, in order to make sure that we can keep our students and our employees in class and on our campus. Any mask that we have around campus that will be available in any of these offices, or I anticipate on tables outside of some of our common student spaces like Hoover Dining Hall, will be free to students. We're just asking them to be reasonable. Maybe grab 1 or 2 to get you through a couple of days, sort of thing.
Stevie Baker-Watson, thank you so much for joining us here.
There are a few exceptions to Depauw's new policy. Those are when someone is working alone in a private office, when students are in their own room, in the rare situation that a class requires it with the approval of the Vice President for Academic Affairs, and when individuals with testing protocols participate in things like athletic competitions or music performances.
As cases continue to rise here in the state of Indiana, Veteran Health of Indiana tells me that their patient response center is answering more than 1,700 calls a day. Jessica Garrig will tell you that it was an honor to protect and serve our nation.
I will never forget 4th of July in full uniform directing traffic, the fireworks.
The Air Force veteran is now battling COVID-19.
Dizzy, fever, stuffy, congestion, cough, sneezing, just feeling miserable.
She's one of many veterans turning to the VA for help with her diagnosis.
It's been great. They've returned phone calls and done everything telehealth. I actually go in tomorrow for a follow-up visit.
Jessica is currently living at Veterans Villa, a permanent supportive housing owned by the organization helping veterans and families.
The people here at Veterans Villa have been beyond amazing. Taking out our garbage for us, getting our mail for us, delivering drinks.
Rodebush VA Medical Center is another option for vets who need centralized care. Their patient response center is staffed by registered nurses answering calls 24 hours a day.
They can request appointments. They also can ask to speak to a nurse if they have, questions about medications or questions about any kind of symptoms or conditions.
Registered nurse Danielle Wolf is one of more than 35 staff members that make up the call center.
When there was a need for some additional nurses to be on the line to take these calls with all these concerns, that's when I actually transferred over to the patient response center.
Licensed practical nurse and office manager Ambra Oyu says the center is now answering nearly 1,700 calls a day.
With the surge comes lots of questions, uncertainty, and we just are, very honored to be able to provide some reassurance to our veterans.
Veterans like Jessica who are seeing firsthand effects of COVID-19.
Keep fighting. It's worth the fight. Stay protected. Don't pass it on if you got it.
Working for you, Adam Schoombs, WRTV.
Don't be fooled by the temperature right now. You will need the heavy coat as temperatures fall throughout the day. Speaking of falling, snow along the Ohio River south will be accumulating snow. You may see it elsewhere in central Indiana, and this colder pattern settles in. But temperatures, they will fall into the 20s later this afternoon. We'll be down below freezing about 4 o'clock in the afternoon.
Live streaming 24/7. This is WRTV News, streaming now.
Just in the first 9 days alone of 2022, the Red Cross has responded to more than 1,600 home fire emergencies across the nation.
A space heater is being blamed for a deadly fire in New York and many other house fires across the country. It's an important reminder of what to do and not to do to prevent a house fire while trying to stay warm in the cold winter weather. Safety advocates say space heaters must be used properly.
They should be kept on a flat surface so they don't tip over, and plugged directly into the wall outlet, not into an extension cord.
You should also keep space heaters 3 feet away from anything that can burn. Choose one that has a thermostat and overheat protection with a seal from a qualified testing lab and automatically shuts off. Turn it off and unplug it when you leave the room or go to bed. The best way to protect your family is to install smoke alarms on every level of your home and test them monthly. Also, have an emergency plan and practice it.
Making sure you've got 2 ways to exit every room in your home. You want to select a meeting spot for everybody to gather that is a safe distance away from your home.
The Red Cross says to also make sure your children know what a smoke alarm sounds like, so they know what to do if they ever hear it.
Thought I'd show you the snow cover map and notice the absence of snow throughout most of the state of Indiana. You go to the east, you go to the northwest, and you find it. There is snow in the forecast once you get to the Ohio River and south. Once again, a southern snow system, 1 to 3 inches, Evansville, Louisville on the south. This happens to be the anniversary of the coldest temperature ever recorded in Indianapolis on this date, 27 below zero. Temperature falling from the morning temperature of 40, then in a couple days in the 20s, it will be dry. The wind direction changes and brings in the much colder air across central Indiana. Plan on wearing the heaviest coat you've got as temperatures drop below freezing by around 4 o'clock. Thursday, 15 to start the day, 25 for the high. Lots of sunshine on Friday. We recover from 12 to almost 30 degrees. Temperatures hover around 30 over the weekend.
The Red Cross has issued an urgent call for blood donations, but not everyone is answering. Matt Pearl breaks down why donations from minorities are greatly needed and what it's going to take to change this disparity.
Do you have your donor ID ready?
Yes. You'll find few places more sterile than a Red Cross center for donating blood. The tubes, the bulbs, even the blood, it all runs the same. If any place was to be free of bias and inequity, it would be this. And yet, don't try to tell Tyranny Bell.
That's something I get all the time, but you don't look sick. And it's like, thank you that I don't look sick, but, you know, I am.
Bell was born with sickle cell anemia. She's one of roughly 100,000 Americans with the disease. Most are black.
I've had multiple surgeries, my spleen removed, my gallbladder removed. Oh, wow, it's so much.
Sickle cell anemia keeps oxygen from the body. It limits physical activity. It starts at birth and stays for life. And it requires a transfusion of blood every month. Blood that comes from someone who carries the sickle cell trait because of the antibodies that come with it. The people most likely to carry it are black. But in America, a tapestry of diversity, the vast majority of blood donors are white. Black Americans make up 13% of the population and barely 2% of donors.
It's never just about the numbers. Red Cross officials are the first to point out there's a lack of access to donation spots in black communities, a lack of direct appeals to black communities, and a history of mistrust in which they admit they played a part.
In blood donation photos from World War II, diversity is near zero. That's because when the federal government and the Red Cross established the National Blood Donor Service in 1941, they excluded black donors. A year later, they changed course, but they segregated donations by race.
We have not always welcomed diverse communities, and that's a fact.
Yvette Marie Miller is the executive medical director at the Red Cross. The segregation policy drew backlash and boycotts. It went away soon after the war, but it set a tone that remains hard to shake.
Some of those health disparities and some of those access issues and inclusivity still remain today. So even though the past informs the present, it's the present that is really part of the issue. You commonly hear people say that when they're asked, why haven't they donated blood? They'll say, well, nobody ever asked me.
And that wariness, that frequent mistrust of the system, extends beyond blood.
In college, it was a little difficult to find a hospital that treated sickle cell patients and knew about sickle cell disease. We have like a joke in the sickle cell community. If a doctor come in and ask you, how long have you had sickle cell disease? Get up and get out, because you're born with it.
Today, the Red Cross runs an entire initiative devoted to finding sickle cell blood donors. And when they get interview requests like ours, they're quick to present volunteers like Hugh Rowden.
I've given 6 donations during the pandemic.
He's on the board of his local Red Cross chapter. On this day, at a blood donation center in a diverse community in Atlanta, the diversity of the donors doesn't look much different from those old photos.
You're always going to have, people who are a little more hesitant. It's important for people to understand that it's okay to give.
For the most part, blood is blood. Race is irrelevant. Donation is safe and sterile. But for Tierney Bell, the implications of a lack of black donors spur her to speak.
It's an invisible disease, so a lot of people don't believe you're in pain, or, doctors still have a hard time managing pain for sickle cell patients. It makes me think, at what point will I go to the hospital and not have the blood there?
In Lithia Springs, Georgia.
That's some sriracha.
I'm Matt Pearl.
Live streaming 24/7. This is WRTV News, streaming now.
WRTV's If You Give a Child a Book initiative raised thousands of dollars to provide books to hundreds of school kids. Our Rafael Sanchez spent the day in Martinsville to see the impact of your donations.
Welcome to South Elementary School in Martinsville, where 265 young people went book shopping.
It's fun, and I just like to just sit down and read by the fire because it's really relaxing. It's just one of my favorite hobbies.
My mom read very good, my dad. They are very good readers. So I started to try and read when I was I think 4.
The love of reading begins right here. Each child able to pick 4 books of their choice, all critical as more young people are learning at home due to COVID.
I'm getting
We're still trying to catch up. It's very important that we're working on those reading skills in class every day, but then that kids can go home and they have books at home that they want to read.
I'm happy I got to.
Reading opens up windows into people's lives, gives them hopes and dreams for the future.
When we arrived at South Elementary School, check out the Welcome Committee. All these young people holding the signs to thank you. This is all part of the WRTV Scripps Howard Foundation campaign, If You Give a Child a Book. And your donations helped make this possible.
Thank you, because it's just really fun to read. And it was so nice of them to donate all that money.
There you go. Enjoy.
This is the second year that South Elementary School here in Martinsville participates in this program, taking young people into page-turning adventures. Working for you in Martinsville, in Morgan County, Rafael Sanchez, WRTV.
The other school to benefit from the book fair is Urban Act Academy here in Indianapolis. In all, the WRTV campaign raised nearly $13,000 to purchase more than 2,500 books.
I've never done anything else. I've never done anything besides music. For me, it just has been clear from the beginning. I'm gonna do music, and that's the end of the story. As I was doing it, I was just kind of like, yeah, no, I don't want to anymore. I realized that I didn't really want to do that, and that's when I pivoted. I started creating online courses to help them achieve their singing goals without having to do one-on-one private lessons. This is a chance to practice your harmonies. I created these pop song exercises where I take a pop song and I make an exercise out of it. And I have so much fun creating these exercises, and all of our students have a lot of fun doing these exercises, which of course is great. And those are the videos that went viral. People have not really seen that before, you know, where you just take a section of a song, I kind of take some inspiration out of it melodically and lyrically, and make a vocal exercise out of it, and then it modulates, just like a regular exercise does. It's entertaining yet still educational, because if it's just entertaining, you're not gonna learn anything. And of course I want you to learn something because you want to get better, but why not have fun while you're doing it? Well done!